I think that there are two very important variables that has quite a negative impact in the life of, of children here in New York City. And one is the lack of jobs, or the first one I should say, the economic factor in terms of the life of these children. And that is translated into the lack of jobs for unskilled migrants who are coming from different lands, and also for African Americans population here in New York City. So if the family don't have the father and the mother or one of them working, then there is a ripple effect on the life of that child that is going to get the impact of the lack of economic means that the family has. There will be further deterioration of health, although I have to say that here in New York City, we have a hospital system that it has access. People do have access to healthcare. Whether the quality is good or not, that's a question mark, and it's debatable. And you go on, and then the same thing is you may not have money, you may don't have a job, but there are schools that the children can go. There is Head Start for pre-K, there's pre-K kids, so forth and so on. But associated with the lack of money, then we have to consider in New York City the prevalence of using drugs, substance abuse among poor families in New York City. And I do believe that that is a direct effect, that people don't have jobs, their life is in despair, and then they fall into using addictive mechanisms to feel better about it. That is very, very destructive for the life of children. So you have the economic impact, then the substance abuse, and then that triggers, I just finished saying a few minutes ago that there's access to healthcare in the hospital system in New York City. However, if you have a mother who is high because of taking opium or whatever else, that child will never go to healthcare because the father and the mother are unable psychologically to function and take them to the access of healthcare. What happens to that child? Many of those children go into the child welfare system. They are removed from those families because the inability of the family well, number one, to be good parents and to function appropriately to support the life of that child. If you ask me, that is direct correlation there between the lack of money, the fact that they don't have a job, and then they fall back into this awful situation of substance abuse. So in New York City, children who have parents who are substance abusers are going to really be impacted from day one, from birth, throughout their entire life because of those conditions. And yes, society in New York City has many programs to deal with kids who have been removed from their family. But the question is, what can New York City do to prevent, to get us to that situation? I believe that the mayor of the city of New York and the city council, and of course the state governor, um, need to put in place a massive program for employment of individuals who are capable of working. We all know that in this country we have gone through a recession, which is already gone. But however, we already know that although the recession uh, has um, has been eliminated, but the businesses are not creating new jobs. They're not even hiring back. So there's a tremendous amount of profits in the business community that is being kept inside, but there are no new jobs. So the mayor has the opportunity to create workforce development in the city of New York through in partnership with the business community of New York City to create jobs for recent immigrants, for the Black American community in New York City, to address that basic issue that I think is so basic, which is the bottom line for me is economic. You have a job, and then you can survive in this society. If you don't have a job, then you're really going to fall into other things. I think that aside from the issue of economics and jobs opportunities for people to improve the economic status in the society, I think that the mayor needs to look at housing. Everything else that can go wrong or does go wrong in a family, you have healthcare, as I mentioned, you have social services in New York City, you have schools, and a whole gamma of very supportive social systems. The quality is for another day discussion. However, what we don't have in place is sufficient housing for affordable housing for those persons who are not able to have the means to pay very high rentals in New York City. I think it's shameful that we have 60,000 New Yorkers every night in a shelter that the city provides to those individuals. I think it's great that the city can do that provide emergency shelter, but emergency shelter cannot become the everyday situation for many New Yorkers. So children need to grow in a house. They cannot grow in the middle of a shelter where there are 20 people in the same room, so forth and so on. So the mayor and the city council should focus on these issues of economic development through creation of jobs, and then also housing, affordable housing for the poor.